Hello everyone. The troublesome effect of many conventional medications indicated during pregnancy have prompted some women to turn to homeopathy. Homeopathy is a safe and effective treatment option for pregnancy related symptoms. So hence myself Dr. UMARANI came with this video, Homeopathy in Antenatal Care. Antenatal care definition is it is a systematic supervision of a woman during pregnancy. It is called antenatal care. Aims of the antenatal care are to screen the high risk cases, to prevent or to detect and treat the cases earliest any complications, and to ensure continued risk assessment and to provide ongoing pregnancy preventive health care, to educate the mother about the physiology of pregnancy and labor, and to motivate the couple about the need of family planning. The objective of antenatal care is to ensure a normal pregnancy with a delivery of a healthy baby from a healthy mother. And what homeopathy offers to a pregnant woman? Homeopathic medicine do not cause any side effects because only a minute amount of the ingredient is used in their preparation. They work by stimulating the body's healing power. If the fetus is genetically diseased or received some hereditary dyscrasia from its parents, it can be removed by constitutional anti-miasmatic homeopathic treatment of the mother during pregnancy. The best procedure to treat such cases like hereditary dyscrasias is to treat their parents' constitutional disturbances before they are expecting to have child. What constitutional homeopathic treatment can be expected to these parents? If parents are having fear, anxiety, restlessness, functional ailments, and history of threatened abortion, they are under comes as a carbonitrosinoid constitution. They are under the psoric background. So these people can be treated with the anti-psoric remedies. If people are having gonorrheal infections, malpositions, and malpresentations, so they comes as that hydrogenoid constitution, and they can be treated as antipsychotic remedies. If persons are having the destructive changes, abnormal pregnancies, habitual abortions, and there comes as the toxicinoid constitution, they can be treated with antipsychotic remedies. Miasmatic approach to treat these cases. The nosodes can do good work, but it should be used when it becomes the simillimum, not just routinely. Few physicians routinely they will use nosodes as the treatment instead of giving the simillimum. It should be avoided. The routine use of sorinum, medorinum, and syphilinum is in general frowned upon because it is the simillimum that patient needs, not that will cure. Example, if a child born with syphilitic skin vesicles, they might give syphilinum rather than the simillimum. It should be avoided. So that child should be treated with the simillimum, not routine nosodes. Prophylaxis in that homeopathy to treat this antenatal problems. Organon of medicine, Dr. Hanneman quoted in the aphorism 284 about that primi and antisoric remedies for the antenatal women. So, any applicable cases, and has to be effect of purifying the fetus from psoric trait, it is advisable to give the mother sulfur 32 globules and allow to act for 6 weeks. After that, a dose of calcarea 30 is allowed to act for 6 weeks. If history of skin disease in parents, then 2 doses of the sulfur 200 at the interval of 2 months, and after the same interval 1 dose of 1 potency to the mother. If venereal trait of women, then 2 doses of Mexal 200 and 1 dose of 10 is advisable. To avoid the syphilitic affecting the child, syphilinum 30 every 15 days and Mexal 6 daily in the morning throughout the pregnancy until the child sucks the mother breast. These prophylaxis can be used in the homeopathically. So care for the mother and the baby should begin as soon as pregnancy is planned or confirmed. So before pregnancy planned and is it confirmed, the care of the mother and baby starts. That we call prenatal care. What is the objective of this prenatal care? To delivery of a healthy infant and maintenance of health of the mother, and the woman enters pregnancy with an optimal state of the health. Role of nutrients and supplements before and after conceive. So, folic acid is the main ingredient and nutrient for this. 400 micrograms of folic acid each day beginning 1 month before becoming pregnant and through the first 3 months of the pregnancy is recommended. Whereas 600 micrograms of folic acid each day during pregnancy is recommended. So, this folic acid prevents neural tube defects before and during the first few weeks of the pregnancy. So, what is the scope of homeopathy in this role of nutrients and supplements before and after conceive? Calcarea fast is that remedy recommended when a person needs it. That is, calcarea fast is irritable because of the tiredness and may long for travel or a change of circumstances. So, these are the key points to prescribe the calcarea fast in that pregnant woman. And ferrum fast is the one more remedy. A woman who has a sturdy build but looks very pale and very flushing red and from any exertion or emotion. So these type of key points helpful for the selection of the ferrum fast. Ferrum metallicum, one more remedy. It can be helpful for nervous sensitive women who often feel weak or tired with easy flushing of the face and a tendency towards the anemia. So these are the some nutrients and supplements given for a pregnant lady before and after conceive. At last, I would like to say that homeopathy is safe for women to use during pregnancy, postnatally, and even breastfeeding. It is a gentle effect system of medicine, and the remedies are highly diluted and are not chemical drugs, so they cannot harm the baby. So, thanks for listening. I will come with some antenatal problems and their homeopathy scope. Keep watching. Thank you.